This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh. Did you know that the number one killer of women in America is heart disease? Surprising? Maybe. We're going to be sitting down with Dr. Jody Zielinski. She's an electrophysiologist, and she's going to explain more about heart disease and what we can do, if anything, to prevent it. Well, thank you for taking some time with us today. We're talking about women and heart disease, and I think that's probably something that a lot of people don't think about. I think when you think about heart disease, a lot of people think it's more related to men, but women are certainly susceptible to heart disease as well.
Very true, and I think often women get overlooked when they present to the hospital with complaining of symptoms because they're not always presenting in the typical way as men do. So sometimes their symptoms can be more vague. They just feel fatigued, abdominal pain instead of typical type of chest pain. Sometimes it is a very nonspecific symptom, so they'll often not be treated the same way a man would when he comes in with more classic symptoms of chest pain that we worry about, a heart attack or other type of cardiac disease.
When you're talking about heart disease, I hear also that cancer, they seem like two different subjects or two different diseases, but they can also be integrated as well?
It's true. So I think part of the myth about heart disease is that women are more prone to die of cancer as opposed to heart disease. That's actually not true. About 1 in every 3 women will die of heart disease, and that's about roughly equivalent to about 1 every minute. And if you think about that, also the sad part about it is that even the survivors of cancer, often some of the treatments or even the cancer itself can cause heart problems down the line. So you'll survive your cancer, be a breast cancer survivor, and then may have to deal with heart problems down the road. And that's actually what's more likely to cause problems down the road than recurrent cancer because our cancer treatments have gotten so good these days.
For folks that have gone through cancer treatment, are there special checkups or things like that we should be aware of for our heart health?
Definitely, and most of the cancer providers are very closely linked to this. They know about these risks that are associated with a lot of the chemotherapies. And so they'll tend to refer they'll get checkups with ultrasounds of the heart to check the function of the heart, and then they'll refer to cardiologists if that's necessary.
We hear heart disease, a lot of people too, I think that myth becomes, well, that's for people that are up there in age. But that's not necessarily the case if you're talking about also cancer patients having to deal with that as well.
That's true. Unfortunately, heart disease is not just limited to the extremes of age or the extreme bad health habits. Even people who are surprisingly in relatively good health can have heart problems. So.
Yeah, and that surprises me. I mean, you would think that just because you're spending so much time working out or being physically fit, you still have to protect your heart and check on your heart.
Definitely. And I think part of it is you cannot outrun your genetics, no matter what you have. Sometimes you have to actually continue to work at what you're doing. And oftentimes people will go into activities like running or racing because they have a family history of heart disease. Or maybe they were, let's say, a little too, had a more troubled youth, did a lot of smoking and bad habits in their youth, and now as they're in their 40s and 50s, they're trying to regroup, and you can't always outrun your bad habits either.
Are there other things that can contribute to trouble with the heart besides genetics and just bad habits?
So definitely there's things that people can control, things like your blood pressure, your weight, how sedentary of a lifestyle you have. So being an active person is definitely been shown to be much more helpful for prognostic factor and to minimize heart disease than a sedentary lifestyle that we all tend to live.
I don't have symptoms. I think a lot of people out there, hopefully you're not having any symptoms, but that doesn't mean that we're in the clear necessarily.
Definitely true. It's always good to talk to your primary care provider and get your basic numbers, your cholesterol, your blood pressure, all of your risk factors checked. And if there's something abnormal, your primary care provider can send you on to a cardiologist who can do a little more examination in the future.
Okay. Hey, thanks for taking some time with us today.
Thank you so much.
Great tips from Dr. Zielinski. Now, the next time you go in for your annual exam with your primary care provider, make sure you ask about heart disease and how it might affect you. I'm Ted Stefaniak. We'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.